I've been thinking about resilience as a kind of an umbrella term.
Resilience is one of the keys during day 2 of the Fire Service Behavioral Health Symposium conducted by the First Responders Center for Excellence.
What does actually we mean when we say resilient? What is it? And I think we have to define that in order to think about how we can use it in our lives. And then we have to, I think, face that there's an empirical reality that it's a complex phenomenon and many different things make us resilient.
The fire service needs to prepare for these new generations that are not only already here but going to be leading them, but who is it that is coming next and are going to be trained? How are they going to be trained? How are we going to respond to them? How are we going to keep them healthy, given their resilience levels are very different?
Suicide prevention remains one of the important topics when dealing with behavioral health.
As much attention as we gave to LODDs, we have rarely tackled the issue of suicide. We have kept our heads hidden when it happens. What we're encouraging now is that we not do that we learn as much as we can, that we do everything we can, because it is simply the right thing to do.
What does stress look like for you?
Stress and techniques for relieving it were on the minds of many.
How do you identify, I know I'm stressed, so I need to step back? Talk to your neighbor, talk in groups, and then we'll talk about it as a group.
I mean, I can definitely tell my sleep too, not sleeping as well.
But what are some things that you guys noticed?
I get stressed, I can test.
Stop breathing.
I started having panic attacks about 7.5 years ago. I wake up in the middle of the night, and that's the scariest thing in the world.
Things like meditation, understanding the impacts of stress and how stress impacts your brain, your body, and different ways that you can mitigate those.
I'm getting tools on how to relieve stress, how to bring stress down, meditation, yoga.
We can all be advocates within our sphere of influence. That may be just at the company officer level, at the clinician side, that may be educating other clinicians about the differences in public safety. But every one of you can walk out here and be an advocate for some of the issues that were talked about today.
As they prepare to leave Denver, symposium participants are looking to put what they've learned into action.
I think that most departments don't have effective behavioral health programs. With all the information that we have, all the data that we have on firefighters' behavioral health issues, it's about time to start building these programs.
The time for talking is done, it's now time to do. And this conference is giving people a lot of tools and tips and programs and ideas to take back to their department to build a program.
Training is one part of it, policy is another part, leadership is another part. All those things have to come together, and I think all of you help play a part in that. So take something, go back and do something, but do the right thing.